This video is about quantifying your alcohol consumption and help you decide the next best step for you. Alcohol use disorder identification test, or AUDIT, is a questionnaire developed by the World Health Organization. It was validated in a study drawing patients from 6 countries. So without wasting any time, let's find your AUDIT status. Now I am going to ask you some questions about your use of alcoholic drinks during this past year. Listen to the questions carefully, and note down the score for each question on a sheet of paper. You'll have to calculate the total score after completing the questionnaire. So are you ready? First question. How often do you have a drink containing alcohol? Now, what's your score? Second question. How many units of alcohol do you drink on a typical day when you are drinking? 1 unit equals to 1 single measure of 40% spirits, half pint of standard beer, or 1 small glass of regular, low, alcohol wine. This is only a rough estimation. Follow the link in the description for more accurate unit estimation. Now, what's your score? Write it down on a paper. Perfect. Now the third question. How often have you had 6 or more units if you are female, or 8 or more if you are male, on a single occasion in the last year? Question number 4. How often during the last year have you found that you were not able to stop drinking once you had started? Please choose the appropriate score. Question number 5. How often during the last year have you failed to do what was normally expected from you because of drinking? What's your score for this one? Let's move to the 6th question. How often during the last year have you needed an alcoholic drink in the morning to get yourself going after a heavy drinking session? I hope you are keeping track of your scores. Question number 7. How often during the last year have you had a feeling of guilt or remorse after drinking? 8th question. How often during the last year have you been unable to remember what happened the night before because you had been drinking? 9th question. Have you, or someone else, been injured as a result of your drinking? Perfect. Now the last question. Has a relative, or friend, or a doctor, been concerned about your drinking, or suggested you to cut down? Please choose the appropriate score. So what does your AUDIT score mean? An abstainer will have a score of 0. A score below 8 means you belong in the low-risk category. You may continue to use alcohol at a minimal level, but it is best if you cut alcohol off completely. A score of 8 or more means you are a high-risk patient. You are at high risk for countless varieties of psychiatric and medical complications of alcohol. Your doctor will help you to gradually cut off alcohol through a process called brief intervention. A score of 20 or more indicate that you are already alcohol dependent. There's high chance you could develop alcohol withdrawal syndrome at any attempt made to stop. Doctors will help you to attain abstinence by minimizing the withdrawal syndrome. Then through various pharmacological and non-pharmacological methods, you will be helped to prevent any further relapses. Thanks for watching the video. Share this video if you know a friend with an addiction problem. Subscribe for more videos in the future. Take care.